Good morning, everyone, and thanks for being here this morning. Today we will be providing everyone with an update on the city's fight against COVID-19. We're going to have several speakers followed by a question and answer. The speakers will be Public Safety Director Wendell Hisrick, EMS Chief Ron Romano, EMS Assistant Chief Mark Pinchuk, City of Pittsburgh Medical Director Dr. Ron Roth, and Mayor William Peduto. So without further ado, here is Public Safety Director Wendell Hisrick.
Thank you, Chris. Good morning. Thank you for coming. Today's the beginning of the pivotal period of time in our battle against COVID-19. This is like a bad dream, and we're trying to prevent it from becoming a nightmare. The temperatures are trying to warm up, and the beautiful weather is forecasted for this weekend and the upcoming next week, which of course is Easter weekend. It means that more people will be out and about and be more tempted to visit our city parks. I'd like to thank the city residents for mostly doing a very good job in maintaining social distancing, but last weekend was an exception within our city parks and public places. They were packed and there was no social distancing. And we have to maintain our vigilance. Now is not the time to let our guard down. Sacrifices have to be made and will hopefully pay off in the long term by flattening the curve and saving lives. The single best way to avoid COVID-19 virus is to stay home. But we understand that people do need to get out. And we are asking that they follow some important guidelines. Instead of going to the park, spend time in your yard or in close proximity to your residence. Anytime you leave your house, try to maintain the 6-foot social distance perimeter, whether you're walking or in a neighborhood or at the park. Try to choose the less busier time to visit the park, either early morning or at evening. And when you visit the park, if you do visit the park, remember the restrooms are closed, the garbage cans may be limited, and try to pick up after yourself if you leave anything in the park. Always please ensure that you maintain your pets on a leash unless it's within the areas designated as off leash, and clean up after the pets. The parks will remain open this weekend. However, you may have noticed the basketball rims have been removed, the overlooks on Mount Washington have been closed, and the playground equipment has been taped off or fenced off. Please be mindful of these measures and do your part. The police and park rangers will be out in force to remind people to maintain the social distance policy. Another reminder is we have to be cautious of having parties. There have been numerous cities reporting that individuals are having corona parties within small areas, and that is leading to many problems, as we're aware of. I'd like to discuss a little bit about the first responder that was tested positive in the past week. He is a firefighter. His interaction was limited to what we believe to be 7 other firefighters. The 1 firefighter that is tested positive has been in self-isolation. The 7 firefighters that he worked with on the day prior are currently in self-quarantine, and they are all doing well. Throughout public safety, we have 1 additional police officer in self-quarantine and 2 EMS workers also in self-quarantine. On the average, with us doing pre-screening prior to public safety personnel coming to work and leaving work, which basically is a list of questions and having their temperature checked, we have on a daily average between 30 and 50 employees that are sent home either exhibiting symptoms or having a temperature. Fortunately, no other employees within public safety have tested positive. The last reminder is please check on the elderly. Call them on a daily basis and make sure that they're doing okay. If you cannot get a hold of them, please call 911. Finally, I'd like to thank the police officers, the firefighters, the EMTs, the paramedics, the park rangers, the animal care and control officers, and all the city employees that are out there on the front lines day to day, ensuring the city essential services are maintained. I also would like to thank the Allegheny County Emergency Services, the 911 call takers and dispatchers for their tremendous work. And lastly, all the respective unions within public safety, their cooperation, working hand in hand with the administration, so far has made this less impactful for the city and for the administration. So with that, I will now turn it over to EMS Chief Ron Romano. Thank you.
Thank you, Director. I'll be very brief. As the Director said, we have to maintain the course. We have to stay the course and keep our distancing and keep everyone safe around us. People we live with, people that we know, our friends, our fellow workers. Precautions are in place for everyone, and EMS that are out there working for you every day. And I thank them, the men and women of Pittsburgh EMS, for what they're doing, keeping you safe, keeping themselves safe, and looking out for each other and the city of Pittsburgh. Thank you. And Assistant Chief Pinchuk will follow.
Good morning. So we've always had a pandemic operation plan. It was built around pandemic influenza. So that plan's been modified to the biology of this organism, at least as much as we know about it. That plan is fully in place at this point, and it is running pretty well. So we're currently under a level 1 operation of that plan, which means we're at normal operations, with enhanced surveillance, protective equipment, and we also put in place 2 specialty infection control units. Those units support the rest of the organization. They go on high-risk calls. They're enforcing proper infection control and PPE use. They're dressing out at maximum levels of PPE to assist with high-risk resuscitator procedures, and they're doing decontamination of units after calls. So those 2 units right now are really keeping the rest of the system running. We have a multi-layered plan to keep people safe, keep people home, and support containment and mitigation. This is in conjunction with our partners in public safety and also with Allegheny County. So right now, when 911 calls are coming in, they're being screened for potential symptoms. The EMS crews are being alerted, and the calls are being sent to the Poison Control Center. A health professional at the Poison Control Center screens those calls, determine if they're high risk for being COVID-19, and they do a safety assessment, and if it's a young, healthy person without comorbidities, they evaluate if those patients can stay home and reduce contact to the rest of the healthcare system. When we arrive on scene, we have an assessment algorithm we do. We just started telemedicine today. So for young, otherwise healthy people that potentially have COVID-19, there's really no benefit to go to the hospital unless they're having respiratory distress or other physiological alterations. So we'll do a medical assessment on them. We'll do telemedicine with a physician from UPMC. And if we can keep those people home safely, we will. That's less stress we put on the healthcare system and less people they're potentially exposing. We have an integrated infection control and personal protective equipment plan. We assume every case now, despite screenings, potentially COVID, and our personnel are using a base level PPE on every call. And if we have to do high-risk resuscitative procedures, they'll dress out at a much higher level, wearing air-purifying respirators, biohazard suits, additional gloves. And the goal is we provide the same level of care to really sick people. So we've seen a lot of people recently with severe respiratory distress, respiratory failure, cardiac arrest, heart attacks, and we've been able to maintain a really high level of care safely using appropriate PPE. So we're definitely in the acceleration phase of the bell curve on this right now. If you look on the county heat maps or where the cases are, Pittsburgh's the epicenter regionally, and we're getting flags back from the hospital on a daily basis that we're transporting COVID-positive patients. So we're going to maintain our operation. One more thing we're doing in support of the health department as part of the containment and mitigation strategy. We also have teams that will go out and collect test samples for COVID-19. Once again, we can keep those people at home, get them sampled, and determine if they're at risk or not. So we're in a good position right now, but like I said, we're going to be humble about this, and we're going to try to be safe. We have a long way to go before we punch through the peak of the curve and get on the downslope of this. But I have a lot of faith in our people out there. They're doing a really good job. And if we follow the science on this, we'll be safe and get through this. Thank you.
Thank you, Chief Pinchuk. I'm Ron Roth, the Medical Director for the City of Pittsburgh Department of Public Safety. The most important thing I want to relay is that we are prepared and we have the equipment. These are difficult times for us, for those of us that work in the hospital and those of us that work in the field. Our police, firefighters, and EMS providers, paramedics, and EMTs. They are our first line of defense against the coronavirus or COVID-19, and we have to protect them and their families. This is a new world order that we've never seen before. We have to do law enforcement, first response, EMS work in the cover of COVID. A police officer can't always stay 6 feet away from a suspect, let alone ask them to put a mask on. And our paramedics and EMTs can't do their work from home. So we have to re-engineer everything. We're battling an invisible enemy, COVID-19. And at this point, our providers have the right equipment, they have the right training, and we roll out just-in-time training as we learn more about COVID-19. Our team has gathered information from around the country and really around the world from others who have gone through or are in the head of the curve from us, and we've incorporated their best practices. Each bureau has a safety committee, and those safety committees have worked very hard to put together guidelines to keep their folks protected. And I'm very impressed with the hard work that they've done. Now that we have community spread, things become a little more challenging. In the past, which was 1 month ago, if you haven't traveled out of the country, you didn't have COVID-19. But as you heard Chief Pinchuk say, we're seeing people with sprained ankles, heart attacks, and overdoses that have COVID-19. It is just much more difficult now. Because COVID-19 is out in the communities, we will have responders who will contract the disease. And you heard that we do have a firefighter that tested positive. We are following the CDC guidelines for healthcare workers, and we have protocols for dealing with ill providers, and we have plans for that. Finally, we're all concerned about our families. We know that if first responders are protected at work, then we're protecting their families. Therefore, it's essential for you, the public, if you're sick, stay at home, maintain social distancing, and wash your hands. Please keep us all safe. So in summary, we are prepared, we have the equipment, and we're committed to keep everyone safe. And again, it is my honor to be the medical director for the Department of Public Safety. It's also my honor now to introduce our Mayor, William Peduto.
Okay. Thank you, Dr. Roth. My role is a little bit different. I'm going to let the professionals talk about what we need to do in order to maintain public health. What I want to do is just talk to the people of Pittsburgh. First off, thank you. We have done a very good job in being able to contain COVID-19 as much as possible. People have made that sacrifice of staying inside and staying away from large gatherings, whether they're inside or outside. However, like the director said, we slipped last weekend. We allowed ourselves to take a step backwards. We allowed ourselves to be tempted by beautiful weather, to gather outdoors in large numbers. We started to stay away from the social distancing, which is the only way that we can win this war. When history looks back, they will look back at April 2020, and they will ask, what did you do in order to minimize the spread of this deadly virus? These next several weeks, and yes, there are several weeks, as the president has said, as the governor has said, we will go through the test during the month of April. And the question will be what we have done in order to be able to minimize the spread of this virus. What I am asking Pittsburghers to do is to stay vigilant, to keep your commitment. There have been sacrifices made by generations before us that asked a lot more of the people than to stay inside. We should think about that when we're asked what sacrifice that we need to be able to make. The difference is exponential. Should we slip and go back into old habits, we will exponentially have more fatalities. That's science. That's not a doomsday theory. That is the science that every health organization in the world has told us, and it is based off of exactly what happened in Asia, in Europe, during this time period of the virus spreading. So as we look at this month, and the weather will stay beautiful like this, we will be tempted to go outside, to have picnics, to have friends over. We'll want to be able to get back on the fields and be able to compete, and we have to be able to say no. No, not only for ourselves, but no to our family members, no to our friends, no to our neighbors who are doing this, and to avoid at all costs large gatherings in public spaces, not trying to mitigate them, but avoiding them to begin with. When we create the priorities during a crisis, just like we did with Tree of Life, we have to have a North Star of which all decision making is based upon. And during this crisis, our North Star is public health. We look at everything, all policies, all programs, all actions of our city government through the lens of public health. And as we go through this month, look, I'll be the first to admit, I like being with my friends. I like being with my family. I do not like being locked up in my house. But if we look through it through the responsibility that each of us have as Pittsburghers, then every decision we make should be made upon the basis of how we minimize the public health impacts to the city we love. That's what I'm asking Pittsburghers to do, to listen to the experts, to listen to the medical and public safety officials that are here to flatten the curve, that have a plan that will work and that will show that Pittsburgh can lead through this initiative, and to do your part today, this weekend, next week, throughout the month of April, to assure that we're able to win this war. Director, if you want to come back up and take questions. Chris?
Yeah, we'll take questions now, and as we did last time, I will try to repeat the question so that the folks watching on Facebook Live can hear the question as well. So we'll begin now with questions. Okay, the question is about enforcement of large gatherings in public areas.
You will see a larger police presence throughout the parks as well as the park rangers. We don't want to have to cite anyone. I mean, citing somebody means writing them a citation, and once again, that's putting the officers and the individuals, we want to try to avoid that. However, depending on what happens this week, we may have to take further action same time next week. And I mean, if there might be people cited the following weeks, or the parks may have to be closed. I mean, that's right now, we are, as mentioned before, we are getting into a critical time, and if we can save one life or one individual from getting the virus, I mean, we'll do what it takes to do that.
So the question is whether or not the city is considering using large spaces, including the convention center, if hospitals become overwhelmed.
I believe the director of the Allegheny County Health Department made it known that the David Lawrence Convention Center is being seriously looked at for an alternate health facility. I've been working with the Allegheny County Emergency Services Chief Brown. We speak several times during the day. And we are both in coordination and talking on a regular basis with Pennsylvania Emergency Management, the Federal Emergency Management, and the Army Corps of Engineers. And we all hope it doesn't come to that, but we are making the plans and the preparations to potentially build a facility within the convention center. And that's, both with the coordination and cooperation with the Mayor Peduto and the county executive, Rich Fitzgerald. It is a plan that is moving forward, and like I say, we hope it doesn't come to that. Mayor, do you have anything?
Yeah. On a daily basis at this point, there is a tracking of the number of cases, the number of fatalities, the number of beds that are being used within ICU, number of beds available throughout the hospital system. And we are now at the point through the data through last week to be able to watch the trends as they're happening. Over the next 2 weeks, the information that we get will be even more helpful in understanding when or if we will see a pressure point with the number of hospital beds within the city to be able to treat the number of cases. And we recognize that many of the cases will be coming from across the city's borders, across the county's borders, and in some cases across the state borders. At this point, with the information that we have as of last week, we are not getting to that point where our hospital system and our medical system will see the type of stresses that they're seeing in New York. However, that is not to say that that isn't a possibility. What will really decide that is the actions of Pittsburghers over the next 2 weeks.
Mayor, I wonder if you could talk a bit about the city's finances. Do you have a better sense of what the loss of revenue is to this point? And secondly, do you foresee the prospect of on city?
We won't have really a good sense of projected revenue until we have a better sense of when this will go back to what we considered normal. When Pittsburgh downtown is filled with people and the parking garages are full. When the Pirates are playing and the Steelers season is not in question and the amusement tax coffers are full. So much of our revenue is contingent upon different revenue sources where we're basically flatlined at zero. Sales of property have plummeted over the course of the past month, and the real estate transfer tax has taken that hit as well. We recognize that we will have a deficit this year. We simply won't have enough money to pay the bills. But we also recognize that's why we created a reserve fund. We have several different options to look at over the course of the next several years to be able to adapt this budget for 2020, 2021, 2022, 2023, and putting together a capital budget which will allow us to borrow and to be able to see the projects that we've been working on for the past 6 years continue. That being said, I would anticipate that there will be another bill through Congress. Speaker Pelosi has begun working on a bill together with the National League of Cities and the U.S. Conference of Mayors that recognize that our economy will never come back if all of our states and cities are bankrupt. Our economy will never come back. So there needs to be a federal plan that directly recognizes that. And whether it is direct grants to states and cities throughout the nation, or whether it's creative financing such as long-term loans of 50 years where 2 generations of people will help to pay it off, we're going to need a new set of tools to deal with this very real crisis on a federal level. It will never be able to happen if cities and states are left on their own to try to solve it. All that will do is prolong the economic downturn throughout this nation from months to years.
In the short term, do you foresee layoffs?
No, we're committed to keeping our workforce. We're committed to working through this next month and then being able to have the opportunity to bring back the workers that we need to start playing catch up to the projects that have been placed on hold for the past several weeks. As we look at next year's budget, can I promise the same? No, I can't do that because I don't know how big of a hole we will have dug this year and what type of assistance our federal government will have given us. But laying off of city employees is right now at the bottom of any of the priorities in trying to determine how to come back financially as a city.
The question for the mayor is how the city plans to use the stimulus package that has already come out and whether or not that money will be used to pay employees.
The stimulus dollars have come through HUD through the Community Development Block Grant Program. There have been some modifications made, but there are still specific rules on how it can be spent. As we look through that, we have not yet determined specific areas where the funding will go to. Part of those funds will also be through the Small Business Administration. Those funds will be used to assist the programs that we've created through the URA in order to be able to provide loans and grants to small businesses within the city of Pittsburgh. Our hope is that we'll be able to leverage those dollars against private and foundation dollars as we look to create an emergency fund for the reemergence of small businesses throughout the city of Pittsburgh. And then finally, financial assistance will go to individuals in the most need, those most vulnerable, with priorities given to the basics of food and shelter and clothing and medicine.
The question is whether or not the city has requested additional PPE from the state or federal stockpile.
As the procedure, the requests go through Allegheny County Emergency Services, and they have in fact requested additional equipment and supplies from Pennsylvania Emergency Management. And not only Pittsburgh, Allegheny County, but all the different counties throughout the state, and of course all the states are requesting. So the supply has been limited, and hopefully we will be able to pick up what we requested as time goes on. Fortunately, we had a very good stockpile prior to this. We knew that there was potential problems coming down the road. We made orders, plus we had stuff that we always maintain for this type of incident. Of course, not to the extent, but right now, for the next few weeks, I feel we're in good shape. However, if it does extend on beyond that, we may have some serious problems. We are making arrangements and adapting to the situation. There has been additional equipment ordered for the Pittsburgh Bureau of Fire, and there has been already in place for Pittsburgh Emergency Medical Services and police that we can use our masks that we use for potential WMD and adapt them for this coronavirus. So I feel that right now we're in very good shape, at least for the first responders, and I don't want to speak for the different, whether it be AHN or UPMC and their stock. So there has also been numerous requests put in through the state from various healthcare facilities other than UPMC and AHN, nursing homes, etc.
Any other questions? I'm sorry, can you repeat that? The question is, aside from potential plans to use the convention center, are there any other updates in how the city would respond in the event of a surge of cases?
Currently, within the city of Pittsburgh, the only plans that are on the table that we're aware of is the David Lawrence Convention Center. You may want to inquire with Allegheny County. There may be other locations outside the city.
Any other questions? All right. Thank you for coming. I do want to add one other thing. We've thanked the public and we've thanked first responders today. I think it's important that we also thank you all. Media is playing an essential role in this crisis, and I know that this crisis has struck newsrooms that are already struggling in deep and meaningful ways. So just want you all to know that what you are doing on a daily basis is appreciated and essential. So thank you all for coming, and we'll let you know the next time we have a media briefing. Thank you.
Thanks, guys.